So talking about the Masters of Public Health program, what are the requirements to get in and what are the concentrations that we're talking about?
Yeah, so for the requirements, we require a bachelor's degree. It doesn't have to be from any specific major. We require 3.0 GPA minimum, and then we require competitive GRE scores. What we consider as competitive is anywhere in the 50th percentile and above. We do look at our applicants holistically. So what that means is that we take into consideration your GRE scores, your GPA, letters of recommendation that you submit, your personal statement, which is super important because we understand that, your GPA may be a little funky just because maybe you had a bad freshman year or you were going through something your senior year. Your GRE, not everybody is an amazing test taker, and we understand that the GRE isn't the most important factor in determining whether or not you're going to do well in graduate school. So we definitely look at all of that holistically. Your letters of recommendation, super important, just because we can see how you're doing academically through your GPA. But we want to know, what are you like in the classroom? Are you collaborative? Are you participating? What is that going to look like, once you are in the classroom here at UF? So all of those things are really important for us. We just want to see that you have a passion for public health. Maybe you don't really have experience in public health, but just kind of seeing that through your statement of purpose is very important. We just want to make sure that you're going to do well in our program and that you're going to benefit from our program. So once we have a good feel for that, is what going to determine whether or not you are a good fit, and vice versa. And then you said the concentration. So one of them is biostatistics, environmental health, epidemiology, social and behavioral sciences, population health management, and we also have a public health practice concentration, which that is typically for individuals that already have a graduate or terminal degree, or they've been working in public health already for a number of years. So that one's a little different. But yeah, all of them, are amazing and have those core courses. It's more so their concentration courses and electives that is going to make it a little different.
Okay. And I see that you all changed the health management and policy concentration to population health management, which I actually really like. I advocated
Right.
for that when I was back in UF. So yeah, that's great to see.
Yeah.
What is the structure of the program? I know there's an online version and there's an in-campus version. I know there's a accelerated MPH and then there's a regular MPH. Just talk a little
Yeah.
bit about that.
Yeah, so we have both on campus and online. On campus, we offer those 6 concentrations that I mentioned previously. Online, we offer public health practice and social and behavioral sciences. So again, public health practice is more so for those individuals that already have a graduate or terminal degree. The difference between accelerated and traditional is that our accelerated applicants or students are going to be those that have a terminal degree. So it's going to be 42 credits rather than 48 credits. So it's just a shorter time frame. And then as far as our traditional on-campus program, that takes 5 semesters. We offer the program full-time and part-time. And then for online, as long as you finish the program within 7 years, you're good to go. Our online program started more so for individuals that are working, and we really try to work around that. And for that, our on-campus program, you do not have to come to campus for any reason. I'm sorry, our online program, you don't have to come to campus for any reason. So all the test taking is proctored through your webcam. The courses are asynchronous for the most part, meaning that, there's a recorded lecture or presentation, so you can access it at the time that, works best for you. Because some programs, you have to be logged on or online at a certain time, like a class time, which just isn't something that has worked for our students. We just want to provide as much flexibility as possible. Um, and yeah, I think that's basically it for that
Yeah,
question.
yeah, I think that's everything you covered. Okay.
Perfect.
Yeah, thanks for covering those things. So I know when I was in my MPH, we did internships, and I think now it's switched over to practicums, and we were only allowed to do our internships at the end of the program, and I think that has also switched.
So a little, so basically what you remember as internship and seminar, so that's going to be applied practice experience and capstone. So whatever we went through in seminar, that's going to be more so capstone. And capstone is also where you develop or kind of discuss your deliverables. So what you present on Public Health Day, which is basically a day where all of the MPH students that are graduating present the work that they've done, or a deliverable that they've done for the agency that they were interning or working with. So applied practice experience is basically that experience of you working and applying what it is that you've learned in courses at the agency. And then the capstone is um, everything else. So anything related to leadership in public health, anything related to how to expand your writing skills, how to find a job after your MPH, and kind of tweaking your deliverable. That's going to be in capstone, and that's going to be more in a group setting. Whereas your applied practice experience is going to be your individual process with that agency.
Thanks for that clarification. So to, I guess, end off everything with the Master of Public Health program, what would you say are the benefits of choosing UF's MPH program?
Yeah, I mean, very similar to what I mentioned before. I mean, we are in an area in the university that is just flooded with, motivated individuals, whether they're students or instructors or researchers that are just have a passion for health in general. Um, Truthfully, our health science center generates a lot of money as far as like funding, grants, things of that nature that I believe, if I'm not mistaken, is more than our football team and like football in general at UF, which is a huge thing. There's just so many different opportunities for you. Speaking of football, like, trauma and head injuries in football, that is something that our public health students and public health professionals in our college that are working on. So it's just very, forward thinking. I feel that our instructors, young and old, elderly, are always just looking at best at best ways to to address issues. So yeah, again, interdisciplinary, funding and resources that is important. At the end of the day, you know, specific to public health, depending on what the government feels should be the funding for public health at the time, it is a struggle. So being able to work with individuals that are creative in the ways that they're approaching situations with limited resources, like those are things that you're going to need if you want to be at the forefront in public health and be successful in public health. So those are all things I feel that we do very well.
Yeah, and I echo that definitely. There are a lot of opportunities in Gainesville, whether you want to work in like the healthcare side of public health, or if you want to work on the nonprofit side, if you want to work with research. There's so many professors doing different work, and if you really put yourself out there, they will definitely try to help you. Another thing I wanted to touch on was the interdisciplinary interdisciplinary learning. There's what is the part of the MPH program that has to do with that? There's like a where we meet with the other health science, well, medical students, dental students, PT students, and all of those such.
Yeah, it's basically a 2 day experience that students have. I believe their spring semester of their first year. It's basically a time for everyone under the health science umbrella. So, veterinary students, dentistry students, pharmacy students, medical students, nursing students, and our public health students, for all of us to come together and work through different scenarios. So basically, it's one student from each of those professions come together and basically spend 2 days together, and complete different exercises. So the purpose of that is for you to really, for it to sink in to each student how important every single profession is to one another. Um, Sometimes these professions are in silos when that isn't the case. Things are connected, and that's the reality. But when you're in the classroom, you're only really learning, for the most part, about one your lane, so to speak. So I think for public health students in particular, it's very exciting when, there's a scenario and, the public health student snaps back quick, because it's just things that other people, wouldn't think about. And again, as I mentioned, public health isn't at the forefront of, health professions as, medical students are. So being in that environment and being able to really have the wisdom that public health students have, is an awesome opportunity. So, I mean, basically, to just wrap up your question, it's just a time for everyone to learn from one another and understand how all of these issues are connected. And when you see somebody, your patient, in your chair in your office, understanding the steps that it took for them to get there and looking beyond the signs and symptoms. um, so yeah.
Yeah, and I really enjoyed doing that 2 day thing with all the different health science students. And what was interesting to me was that most of the activities that we did, I was leading my team just because no one really knew what to do. I definitely had the knowledge and the skills to address the situations that were brought up better than any other of the schools. So I definitely think UF is doing great in that with that in regard. So I
Yeah,
really
I
enjoyed
agree.